For the healthcare and wellness track, we're speaking with HeatherBucalos of 18 Loop. They're part of the panel Virtual Reality Therapy and Family Intervention Research Findings and Practical Recommendations. Heather, thank you so much for joining us today.
Thank you for having me.
It's our pleasure. Can you please tell us about who you are and what you do in the metaverse?
Sure, my name is Heather Bucalos, and I'm a registered nurse. I'm also a two-time cancer survivor. And the second time I went through cancer treatment, I used virtual reality during my own treatment, and it really improved my treatment experience. So now I'm an advocate of virtual reality for healthcare. And my main goal is to advocate the use of VR for cancer patients specifically, as well as other patients and some of the older. Just scratch that. Sorry.
Can you actually tell me a little bit about what that experience was that you had in your own treatment that got you interested in and advocating for this kind of technology in your work now?
Sure. So when I went through cancer treatment the first time, I experienced a lot of pain and discomfort. And when I went back to work, I ended up starting to teach Lamaze classes. And we did so much of the meditation and breathing exercises and focal points and mindfulness in Lamaze that I thought, why couldn't we take some of what we're teaching in Lamaze and transfer it to pain management for other types of patients? And I thought back to my experience during my cancer treatment. And around that same time, I discovered Google Cardboard for the first time. And so I started thinking, oh, what if we put Lamaze into VR? And then we distributed that modality to other patients, like cancer patients or patients who are dealing with chronic pain scenarios. So that marriage of those three items really came together. And I started researching and finding companies who were already doing this. And then around the same time, I ended up being diagnosed with cancer a second time. And I actually used that idea for my own treatment. And I thought, well, this is the perfect time to try it out.
So you actually brought that idea of VR meditation and mindfulness during your treatment to that second round of treatment that you needed to go through?
Yeah, so I reached out to a virtual reality company who was already working in the space, and I was lucky enough to be able to try their headset and their program. I brought it to the hospital with me. I also brought my neighbor's Oculus Go with me to the hospital. And so there I was sitting in the hospital bed trying out these virtual experiences and swimming under the ocean while I was actually in the hospital. And I would share VR with my doctors who would come in. And it really gave me, there were two benefits to this. One was it was something that I could focus on besides my illness. So it was something new to me and I could explore it and I could try new things and figure out if this was going to work for me and maybe if it would work for other people. And at the same time, I was evangelizing it as a patient and sharing it with my providers. And then, of course, the benefits of virtual reality were that I was distracted from the pain that I was experiencing due to treatment side effects. And I was able to immerse myself in pleasant experiences like swimming with the dolphins or being on a beach in Portugal and have the sun shining down on me. Meanwhile, I was actually in the hospital in the middle of winter in Buffalo, New York for 30 days straight on a locked unit. So there really were a lot of benefits for me to use VR in my experience.
What a empowered and resourceful patient. I am impressed with your curiosity during that difficult process, and so cool to hear you advocating for it and teaching in the midst of your own treatment. Wow.
Well, I have to thank my background as a nurse because I think in both scenarios, that's really what got me through the treatment process, but also to be able to evangelize something like a new treatment. I really fell back on my nursing training and to experiment and try different things. And as a nurse, I had always tried, I think pain management was my biggest focus for patients, like their comfort. And so for me, in my own experience, I just took my professional experience of providing comfort relief and gave that to myself.
I am so impressed. Moving on a little bit more lightheartedly, how often are you in the metaverse and what do you do there these days?
So I'm in the metaverse a lot more often when I'm with my grandfather. Otherwise, I would say maybe about once a week for myself. But the majority of my time is spent evangelizing and advocating for other people to get into the metaverse for the very first time and to explore the benefits of virtual reality and to discover the metaverse for the first time themselves.
Thank you so much. Is there a big idea that you're hoping to share with your AWE audience this year at AWE 2022?
Sure. So what's the big idea? The big idea is if a virtual reality headset could talk, it would say, "Why don't you try me for this scenario? Why don't you try me for your healthcare scenario?" So I have this talk called The Voice for Virtual Reality, the advocate's role. Like the big idea is to bring a voice for VR, a voice to VR for more than just entertainment purposes, to advocate for virtual reality in the healthcare field and or for to benefit the healthcare industry.
hmm I love, Heather, the idea of being an advocate for the technology that's there to show you that it's more than just the technology. It's more than just that first use case that you've seen, but there are ways that we can use this in our lives in meaningful ways with our parents, with our kids, that has impact beyond just being a viewer of something. Being That's amazing. So similarly, is there anything that you're hoping to learn this year at the expo?
I'm definitely hoping to get my hands on some haptics gloves or to be able to experience haptics. So, smell and haptics with VR is probably something that I'm very curious about. And I would love to just be a sponge when I get there and absorb as much information as I can.
I don't know how we did it, but we are at the speed round. So the next question is, do you have a metaverse avatar? And if so, what does it look like?
Yes, I do have a metaverse avatar. She looks very similar to me. I did not get too creative with her, but pretty sure she has brown eyes, brown hair, and a pink shirt on with a gray blazer. And that's as basic as it gets.
Was there a reason or a driving force for you to choose to go sort of realistic and representational rather than jump into the endless possibilities with your avatar?
Probably because my creative outlet lies in other areas. So I wanted people to be able to remember who I was in the metaverse and in the universe. So I wanted people to be able to remember who I am and not get distracted or not forget who I
I love
am.
this idea though, right? Like where as a nurse and as somebody who is caring for people in virtual environments and in physical environments, right? Or who is using VR and XR in a professional sort of advocacy way, there's a strong need, right, for you to have that persistence and that consistency. Where if your purpose in VR were slightly different, if you're for social reasons or for entertainment or others, the I could see why you might feel more freedom to be different just based on that use case. So it seems totally logical to me.
Yeah, maybe just the congruency so that people recognize me in and out of the metaverse or in and out of real world and the VR world.
One of our last questions here is just the opportunity for you to introduce us to somebody or some buddies who have been meaningful in your journey in the metaverse. Is there anybody that you'd like to shout out to?
Yes, definitely. I'd like to thank Joe, Tom, Denise, and Beth for being my metaverse mentors, and Josh for helping me to take some of the first steps into VR for healthcare and giving me the bridge to reach virtual reality in the healthcare field.
How amazing to have mentors and guides who can actually bring the metaverse to you in a time of need. Thanks to all of those mentors. That's great. Is there is there anything we missed? Is there anything that you want to make sure that you can share with the AWE audience or anything?
If anybody wants to chat in real life, I'd be happy to make some connections IRL and be happy to chat about my experience using VR as a patient as well as professionally in the healthcare field.
I suspect your dance card is going to be full with that kind of generous offer. This has been Heather Bucalos. She is a board director at 18 Loop and speaking on the healthcare and wellness track at AWE 2022. Heather, thank you so much for your time with us today.
Thank you for having me. I look forward to joining you at AWE.
Love it.